ASMR. Oh, hi. Welcome. Are you at 2 o'clock? Perfect. I'm Emily. I'm one of the nurses here. And we have you in for a smoking cessation intake appointment. Is that correct? Perfect. Okay, so basically what this entails is we're going to have a conversation, and then at the end of our appointment, I will either be sending you with a prescription for a medication or some type of nicotine replacement therapy. Something like a patch and maybe some short-acting nicotine replacement, okay? So, this appointment is going to involve me getting a lot of information from you. Demographics, smoking habits, other habits, and we will counsel you and go from there, okay? Perfect. Do you have any questions before we begin? Wonderful. Okay, can I just start out with what's your name? Perfect. And your birthday? Good. And your phone number? Wonderful. And your street address? Okay, is there a unit number or a box number with your address? Okay. Wonderful. And your city or town? And your post or zip code? Wonderful. All right, this is your first time at our clinic, is that right? Okay, who's your family doctor? Okay. And have you seen him lately? Like for a general checkup or for any prescriptions? Okay. Okay, good. Alright, to start out with, are you allergic to any medications, allergens, like environmental exposures, or foods? Okay, and what happens if you have that? Okay. Are you on any type of medications, prescription? Either pills, puffers, patches? Okay. And dosage? And how often do you take that? Twice a day. Okay. Are there any as needed over the counters that you take? Ibuprofen, Tylenol, Gravol, Benadryl? Okay. And what do you take that for? And when was the last time you had a dose of that? Perfect. All right, past medical history. Do you have any past medical history that we need to be aware of? Okay. Okay. All right. Any depression or anxiety? Any heart attacks recently? Okay. Pregnancy, breastfeeding. Okay. Okay. And specifically any lung conditions, COPD, asthma, emphysema, fibrosis. Okay. Perfect. Okay. So as far as your intake, so do you smoke or do you vape? And do you do this daily? Okay. And how many times a day would you say? About 25, so a pack a day. That's what the equivalent would be for vaping as well. Okay, and how soon when you first wake up do you have your first cigarette? Like within 5 minutes, or 6 to 30 minutes, or 31 to 60 minutes? Okay. All right. And what is your height? And your weight? Perfect. All right. How old were you when you started to consume nicotine? Like on a daily basis? 13? Okay. Have you ever quit smoking? How long did the quit last? Okay, and why did you start again? I know quitting is very hard to do, especially when you're stressed and have that much going on. But we'll get you set up on the right track, okay? Perfect. All right, and when you did quit before, did you quit cold turkey? Did you use nicotine replacement such as Nicoderm and lozenges, gums, inhaler, that kind of stuff? Or did you use the medications, Champix or Zyban? Okay. Did you have any side effects with that? Bad nightmares. I know that's very common. Unfortunately, they do usually improve as you continue quitting, but it's definitely not great to be experiencing that on top of all the stress your body's going through when you stop using nicotine. All right. Okay, so how many coffees do you drink per day, or caffeinated drinks? Okay. The reason we ask is when your body stops getting nicotine, your body does not break down caffeine as well. So if you continue drinking the same amount, you may end up getting like a little bit of a jitter. So you may need to cut back your caffeine intake. How many servings of fruits or vegetables do you say you eat a day? Each serving is about half a cup. Okay, so you are a little bit below the recommended average on that. That being said, I feel like most of us are, but I'm just supposed to counsel you and tell you to increase that to the daily recommended servings. Okay. And do you use marijuana at all? Either vape it, smoke it, eat it, drops, anything like that? Okay. And have you ever? Okay. The reason we ask this is a lot of times when people smoke marijuana and they mix it with nicotine like tobacco, it does create more of a high, so they find that when they switch to just using cannabis, their high isn't the way that it was when it was mixed with nicotine. So we do like to ask that, because then we have a general idea of other ways we can assist you. All right. Okay, do you drink alcohol ever? Okay, how often? Monthly? And how many drinks would you say you have at one time? Do you ever have over 5 at a time? Okay, so the reason we ask that is that's considered by the guidelines risky drinking behavior. At this point, drinking monthly, you wouldn't really have an issue with that, but just know that binge drinking like that can contribute to alcoholism, but just keep an eye on it. If you ever do need help, or if you ever have a problem quitting, come see us. We can definitely help you out with that, okay? Do you gamble at all? Like scratch tickets, casinos, online, anything like that? How often? Okay. All right. Okay, so I think that is most of the information I need from you. So there are different, like I mentioned, there's a few different routes we can go depending what you're looking for. We could either do a medication, which is Champix or Zyban. On those, you take medications every day and you quit smoking basically because it tastes awful after that. A lot of people prefer the nicotine replacement route, but some people do prefer the Champix or the Zyban. That being said, they can cause weight gain. A lot of people have terrible nightmares from it, but at the end of the day, if it helps you quit, then I think that's a plus. The second thing that we could offer is to do like a nicotine replacement. So we normally start out with Nicoderm patches. There are 3 steps. So the first step releases 21 milligrams per day and is for people who smoke over 10 a day, which is what category you would fall in. The second is 14 milligram patches for people who smoke less than 10 a day, or after you've done so many weeks on the first step. If you're a heavier smoker, then you titrate down to the second patch. And then lastly, what I have here is the step 3, which is a 7 milligram patch. Basically what it is a rate controlled nicotine delivery. So what happens is you put it on, and actually I'll show you what it looks like. It is a little clear patch. Basically what you do is you peel the backing off and you stick it on your upper body somewhere. I usually recommend doing on the arm, and then the next day you pull it off and then put it on the other arm, a fresh one. You can smoke with these on. There is a common misconception that when you quit, or if you smoke while you're on these, that you will have a stroke. That being said, I've been running this program for a long time. I have many people who continue to smoke while they're on the nicotine patch, just as a way to decrease how much they're smoking, and honestly, there's been no issues with it. So that being said, if we put you on the nicotine replacement therapy, we could start out, in your case, on the first step, and then you do that for 6 to 8 weeks, and then you go on the 14 milligram, which is the step 2. You'll do that for 2 weeks, and then after that we'll switch you to the 7 milligram patch, which you also do for 2 weeks. We also provide short-acting nicotine replacement therapy as well. So I have gum, I have lozenges, and I have nicotine inhalers. We do not carry the spray anymore, the nicotine spray, which was more of something you sprayed in your tongue. And a lot of people liked it, but unfortunately we stopped carrying that. So with the patch, in conjunction with that, you would use either the gum, the inhaler, or the lozenge. I do recommend the lozenge. More people do like that. It's like a peppermint mint that you put in your mouth when you're craving a cigarette, essentially. And then eventually over time, like for example, when you start out on the first step, for the first couple weeks, you may use up to 10 or 15 lozenges a day, and then after that you titrate down to about 8. And then after that we switch you to the next step. If you do want to go with gum, we can provide that as well. A lot of people don't like the gum as often because when you're always chewing it, they find that their mouth hurts, their jaw hurts from repeated chewing. So some people like it, a lot of people don't. One thing that we have been giving a little more frequently lately is the Nicorette inhalers. So basically they are a little plastic cartridge or a little plastic tube you open up and you put a cartridge in. Each box has 42 cartridges. You change it every 24 hours. Even if you don't use it over the 24 hours, the nicotine actually dissipates from it. So you change it every 24 hours or after 20 minutes of use. It doesn't actually get inhaled into your lungs. It absorbs through your buccal membrane, which is your cheeks and your tongue and your throat. So you don't actually need to inhale hard enough to get it down to your lungs. Although if that's what you feel like doing, that's fine. A lot of people do like that. The thing with that is I find it very hard to decide when you've already used it for 20 minutes. So the best way to say is, if you go with that route, if you feel some anxiety, you need a short-acting nicotine replacement, if you take an inhale and you find that it's not soothing your anxiety, try changing the cartridge. At that point, that will fix the problem usually. But just as far as controlling how much nicotine you're getting in a 24-hour period, you would probably be better off to start with the lozenges. They're very good. They don't taste bad, and they actually stay in your mouth for quite a while, even with you sucking on them. So that is one good thing. What else was I going to tell you? Like I said, you can smoke. I have a lot of people who use the patch and then either the lozenge or the inhaler, and then also smoke on top. I've seen people go from 50 cigarettes a day down to 5 or 10. And that being said, quitting smoking is one of the hardest things out there. So, basically harm reduction, anything less than what you're currently smoking is healthier for you. We can cross that bridge when we come there, but what are you thinking as far as your options? Are you thinking more the medications or more the nicotine replacement? Okay, nicotine replacement. I think that's a great idea. So what we'll do is I am going to send you home with 2 weeks worth of products today, and then you are going to come back in 2 weeks and follow up with me. At that point, if you like the products I have provided, I will send you home with an additional 4 weeks. You can get up to 26 weeks covered while on this program of free nicotine replacement. So essentially in a 12-month period, you get 6 months of free products. So it works out actually pretty well. Most people don't require to be on it for the full 6 months unless they are just using it as a controlled way to decrease their smoking. Some people continue smoking through the entire 6 months. Some people say that would defeat the purpose of it, but at the end of the day, they're smoking less, so that's a good thing. Okay, so you're okay with this? Okay, we'll start you with the 21 milligram patches. Just some education, general education surrounding it. When you go to put it on, a lot of times people get itchy around the edges. That is completely normal. A lot of people say, oh, I'm allergic to the patch because it made me itchy. Normal reaction. Nicotine is an irritant. That's why when you take nicotine lozenges, there's that little peppery, spicy flavor essentially, whether it's the spray, the gum, the lozenge. These are no different. You put it on and for probably about 5 or 10 minutes, you feel a little bit itchy. As long as your arm is not swollen or red, just tough it out. I promise it'll go away within 10 minutes. When I've used them in the past, I've itched around it and some of the glue has come off, which is fine. It should stay stuck on for the full 24 hours. Just make sure you're not applying any lotions and you're not using any body washes or creams that leave a residue. If you do have issues with this sticking on your skin, we can put a Tegaderm, a flat tape on top of it to keep it affixed to your skin, but we'll see how it goes without it first, okay? Perfect. All right. So basically I'm just going to get your email if you have one, so then I can send you a copy of the program, all the products we have, and some extra resources in your email as far as quitting, dealing with withdrawal symptoms and things like that. Can I get your email? Wonderful. Okay, and I have your verbal consent to enroll you in the program. Wonderful. Okay. So if at any point in time you have any side effects that you do need to talk about, or if you just need some motivation, call me. I am here every day, Monday to Friday. I can help you out at any point in time. And just remember that even if you don't quit immediately, even if you are still having a few cigarettes a day, it's still a win in my books, because if you're smoking less than you are right now, that is amazing. It's very hard. Kudos to you if you can do it right off the bat. Most people can't. So just give me a call if you need any motivational pep talks, okay? Perfect. All right. So what I'll do is I'll get you to go see the receptionist, and I'm just going to send her a message and let her know what she is dispensing to you, as far as 2 weeks of the 21 milligram patches and a thing of lozenges, a box of lozenges. And then she will book you up for a follow-up appointment with me in 2 weeks. Okay. All right. Good luck, and you will do amazing, okay? Okay, I'll see you in a couple weeks. Okay.